Good afternoon, ladies and gentlemen. My name is Tiaan Jager, and I'm the Dean of the Faculty of Health Sciences and the Director of the University of Pretoria Institute for Sustainable Malaria Control. We are live from the University of Pretoria's Future Africa Institute and campus. Despite the current focus on COVID, malaria remains a global public health concern. In 2019, more than 229 million malaria cases were reported worldwide, with the highest occurrence, about 94%, in the African region. There are numerous challenges that impact on malaria control and elimination. One of these being the increased resistance of malaria parasite to the drugs used for treatment. At the University of Pretoria research team has discovered a new potent chemical compound that shows potential as candidate for both the treatment and elimination of malaria. Today I have a discussion with Professor Lyn-Marie Birkholtz, who is leading the UP team along with national and international partners that made this breakthrough discovery. Before I introduce Lyn-Marie, first some background on malaria research at the University of Pretoria. The UP Institute for Sustainable Malaria Control is a fully integrated, transdisciplinary and interfaculty initiative. The aim of the Institute is to coordinate and promote collaborative research on safer and sustainable malaria control and management strategies, and to generate new knowledge and support new activities pertaining to safe malaria control in Africa. The Institute hosts the South African Research Chair on Sustainable Malaria Control and the National Research Foundation, or NIF, Community of Practice, or COP, on malaria elimination, with Lyn-Marie Birkholtz as the Director and Primary Investigator, respectively. The UP Institute for Sustainable Malaria Control is also a South African Medical Research Council collaborating centre for malaria research. The Institute consists of 3 research clusters, namely the Human Health Cluster, Parasite Control and the Vector Control Cluster, with research within and across the different clusters, with the aim to support government in its efforts towards malaria elimination. The UP ISMC is celebrating its 10th anniversary this year. Since its inception, the Institute has delivered top quality research on various aspects of malaria and malaria-related challenges. Innovative and novel control strategies and tools, and creative ways to educate those affected by this devastating disease. We should never forget the communities. Together, more than 40 researchers, academics and their postgraduate students from different backgrounds and from various departments across all 9 University of Pretoria faculties and Gibbs Business School have all been working towards a common goal, to contribute towards the elimination of malaria in South Africa, Africa, and globally. None of this would have been possible without the support of the Vice-Chancellor and Principal, Professor Coupe, the UP Executive, and the University for creating a stimulating environment to allow for breakthrough research. Lyn-Marie Birkholtz is a professor in the Department of Biochemistry, Genetics and Microbiology in the Faculty of Natural and Agricultural Sciences. She heads the Parasite Control Cluster within the UP Institute for Sustainable Malaria Control. This cluster aims to contribute new knowledge and expand on internationally recognized existing expertise in structural and functional genomics of malaria parasite in order to identify alternative, sustainable biological and chemical malaria control parasite mechanisms. Lyn-Marie, congratulations to you and the team on the Nature paper, and thank you for taking the time to discuss the breakthrough research that the team of researchers have made. Since the news broke a week ago, there have been many questions around the discovery, its importance, and what it all means. So first of all, why is it so difficult to get rid of malaria?
Yeah, well, thank you, Tiaan, for the invitation, and thank you for that question. And I think it's a very difficult question to start off with and to answer, actually. And I think basically it revolves around the fact that malaria is such a complicated and complex disease. It really has to have three biological systems that interact with each other. So it has to have a human that gets infected by a malaria parasite. And this parasite is transmitted to humans then by mosquitoes, particularly malaria mosquitoes. And unless we have this interplay between these three biological systems, we won't have the disease. But that makes it very difficult to then control and ultimately eliminate the disease as well, because you can imagine we have to target these three biological systems independently and very effectively, but in a concerted manner. And that is really the crux of it. We have to be able to control the vector, the mosquito. We have to, and we do this with vector control tools. We have to target the parasite, and we do this with antimalarial drugs. That's really the most effective way we have at the moment. And then human behavior as well. Early diagnosis and treatment is so essentially important in controlling and contributing towards malaria elimination. And all of our mechanisms at the moment is under a little bit of pressure. We know the parasite, like you just said, is becoming resistant and is resistant to most of our tools that we have, our antimalarial drugs. And also the malaria mosquito vector is becoming resistant against insecticides. On the human host side, we have human migration, and we also have external factors like climate control and seasonal changes. So all of these things make it a very big challenge to control malaria.
Yes, I think climate change should not be ignored within this bigger scenario. So there are existing drugs against malaria. So why is this discovery of new potential drugs and malaria transmission blocking agents so important?
Yeah, thank you. That's a very important question. The problem that we have currently is that, like I said, the parasite is quite a clever little organism, and it's becoming resistant against all our current antimalarial drugs that we can use clinically. So we have to come up with new tools, particularly chemical tools that are able to target the parasite continuously. We have to preempt the fact that it will become resistant every single time we throw something at it. So in the drug discovery field, we have to come up with new innovations the whole time. But what's really quite tricky with this parasite as well is that it has multiple forms. I'd like to always refer to it as a little bit of a shapeshifter. And it has these forms different forms that then evolve and mature inside humans. So the first form is the stage that infects your liver. And at this point, we can use prophylactics to prevent the onset of infection in a human. Once we have disease symptoms in a human, we of course have to treat these symptoms and we have to save lives. And we do this with antimalarial drugs, so chemotherapeuticals. But unfortunately, these two prophylactic drugs and chemotherapeuticals are not very good at actually blocking and killing the transmissible stages. And now I'm talking about transmission of the parasite from the human host back to the mosquito to continue this life cycle. And that was really it's still continuously the gap in our toolkit for antimalarial drugs. And that's really what we were looking for at the University of Pretoria with our national international collaborators.
Thanks. You've shared the principle with us, but please give us a very brief overview of the breakthrough discovery that was made and explain some of the science behind it.
Yeah, so we went a little bit out of the box in terms of our thinking, and we tried something new. So traditionally, if we're looking for new compounds that's going to kill the parasite, we do this by looking for the stages that is causing symptoms in human first, so the blood stages. And once we have a compound that kills and hits these blood stages, then we look for additional activities that are able to block, for instance, liver stage development or these transmissible stages. But unfortunately, like I said, there's a lot of attrition, and a number of these compounds will never pass and actually kill these other stages of the parasite. So what we decided to do was not to pre-filter based on one stage of activity alone, but we tried to do this in parallel. So we screened for compounds, all the same compounds, for every single life cycle stage in parallel, to make our chances highest that we actually get compounds that are able to hit the different forms of the parasite, because the biology behind these forms are, of course, very different. So if we are able to sort of hit the vulnerabilities in the different life cycle forms specifically, then we have new tools in place. And that's exactly what we were able to achieve with this Nature Communications paper.
Great. I think the more tools, the better the chances to eventually get to elimination, eh?
Absolutely.
So, Lyn-Marie, what is this pandemic response box that played a role in the discovery?
Yeah, so this is really a toolbox that was put together by the Medicines for Malaria Venture, and they were a partner on this project. And this is a toolbox it's an open resource toolbox. So it's a collection of about 400 chemical compounds that they put together, and these compounds have ascribe activity in previous diseases. So there's a couple of compounds that have anti-cancer properties, antiviral, antibacterial, and antifungal properties. Not necessarily all clinically used drugs, but investigative compounds. And the beauty of this box is that it allows you then, instead of having to screen thousands and thousands of compounds, you can screen the select set of compounds for which there's a lot of information available already, and hopefully you can get to these hit compounds that allows us to explore both the activity as well as the biology a little bit further.
Very interesting. So it also highlights the importance of collaboration and a transdisciplinary approach. So tell me, your team at the University of Pretoria focuses on the transmission blocking drug discovery as a partner of the South African Malaria Drug Discovery Consortium. Please tell us about your team of collaborators and how the transdisciplinary contribution towards this work added value.
Oh, absolutely. I firmly stand by the fact that you cannot do this type of work on your own in silo, and it has to be a transdisciplinary effort. And indeed, it was so super successful in this project. So initially, anti-malarial drug discovery in South Africa was led by Kelly Shibali's team at the H3D at UCT. But at that point, we in South Africa realized that we needed innovation, and we needed to expand on our expertise in South Africa to also contribute to malaria elimination. And that's exactly where we got involved in the University of Pretoria, because we then at that point initiated this collaboration with UCT as well as with Wits University and the CSIR. And we led the establishment of this transmission blocking drug discovery platform. So it was extraordinarily important to get the technology in place in South Africa to be able to do this work. Before we started out with this, we had no abilities to be able to grow these different life cycle forms of the parasite, so we couldn't even screen new compounds for these activities. But through this collaboration, and I must also say through the support that we had from the MRC and the Medicines for Malaria Venture to do this, we were able to get this platform on the table, and it's now a very useful platform and completely transdisciplinary. Myself as a parasitologist, a biologist, and a biochemist, work with entomologists, work with chemists, work with pharmacologists. It is extraordinary the way this meshes together to lead to success.
Lyn-Marie, as you know, for government and for everybody, elimination of malaria is important. There's specific timelines, and we chase those. But my question is, when it gets to a discovery, surely this discovery did not happen overnight. How long has the team been working on this before the breakthrough came?
Yeah, so absolutely, this does not happen overnight, and it takes a whole lot of hard work and absolute recognition to my whole team and the rest of the people involved that worked so hard on this. So like I said, we initiated this collaboration and this whole consortium by establishing technology first. And that took us about 3 years to do. It was not a trivial task, but now we have this resource that's available for the whole of Africa, frankly, to use, as well as international partners. And after 3 years, so it's been about 5 years in playing, so we've been able to use this platform for various other projects as well. But the one that was now published, it took about 2 years in total, the amount of work that we published. Yeah.
Well, not only the University of Pretoria, but I think the country and the continent is very delighted with this breakthrough. What are the potential benefits of this discovery? What does it all mean for malaria, for you as a researcher, your team, and the institution, for example?
Yeah, so to take it firstly by answering the question, what does it mean for malaria? I think the importance and what we're quite excited about at the University of Pretoria is this contribution of these compounds that are able to block the transmission. Because now for the first time in South Africa, we have something in hand that specifically can do that and can be specifically developed further to do this. And you can use this almost as a standalone tool. So you can envisage in South Africa that is a pre-elimination, in its pre-elimination phase. We can target hotspots of malaria, like in Limpopo province. We can go into a community, use this as a mass drug administration tool, or almost like a chemical vaccine. And we can target people that are walking around with these transmissible stages. They're asymptomatic. They don't know they are carrying these transmissible stages. They don't know they are continuing to spread the disease. But we can hopefully target them and through diagnostics, very sensitive diagnostics, treat those patients and mop up those parasites. As in terms of the research capacity, of course, it's very important to always, if you work on an African-centered challenge like malaria, to be able to show that your research is not only lab-based, it's not just academic research, but it actually has translation into some tangible outcome. And I think that's why it's so important for the university as well.
So Lyn-Marie, the big question, what is the next step?
Yeah, so this is just the tip of the iceberg. We're literally just in the discovery phase. It's not yet a cure for malaria at all, by all means, but it does give us this additional potential to develop a new tool that it's going to fit into the big toolkit that we require to hopefully eliminate malaria. So these compounds still have a long way to go in terms of further development, and we have to do our due diligence to push them to a potential preclinical candidate status. It also means a lot of innovation for South Africa because some of the models that we require to test these compounds with are not available, and we would need to develop those in future.
Lyn-Marie, I see we've got a question from one of our viewers that came in online. Somebody familiar to us, Professor Leo Braak. Any comment on the likelihood of a vaccine in the medium term?
So a vaccine would be the alternative tool to target the malaria parasite. Indeed, there's been a huge amount of development towards a malaria vaccine. It's a bit more complicated than, for instance, the COVID vaccine that has happened so quickly. But there are very good frontrunners for malaria vaccines that are being trialed and used in very specific geographic areas in Africa. We're awaiting those results of large population studies, and I think it will be an additional tool that we can use in the future.
Thank you. Something I'm thinking about, and you're very much aware that within the University of Pretoria Institute for Sustainable Malaria Control, we've got an integrated approach. And one of our flagships is the remote sensing for malaria control in Africa, where we look not only at climate change, cross-border movement of people, where the parasite would play an important role, but the vector and all the related aspects. How do you think this breakthrough or new evidence would help in an integrated approach, screening maybe people when they cross borders?
Yeah, absolutely. An integrated approach is, in my opinion, the only way to go forward. And this has to be, like you said, on the vector level, on the human level, as well as on the parasite level. Remote sensing is extraordinarily important. We have to be able to understand where malaria outbreaks are. We also have to be able to understand how malaria is transmitted or is crossing borders. Of course, there's no borders for malaria. So for a country like South Africa to eliminate malaria is going to be an impossible task unless we do this in a regional context. But that also means we have to, if we do eliminate malaria in a certain region, we have to keep it clean. So a tool like that, the transmission blocking drug that we are envisioning, can potentially have this massive application where we can screen, if we have the sensitivity in terms of diagnostics, to screen patients that are walking around with these transmissible stages, that we can then treat them at, for instance, border posts, and we can prevent them from spreading the disease within our borders.
And of course, we're working with government, the provincial governments, national governments, SAMEC, which is the South African Malaria Elimination Committee, all a team effort towards elimination. And I think every tool can just get us a step closer to where we would like to be. I see there's another question that came in. How long estimated time before the new drug can actually be provided to communities? So that's jumping a bit, but would you like to take a wild guess on that?
Yeah, so I think we have been very, very fortunate in the anti-malarial drug discovery arena worldwide, in that there are very good systems in place, supported by people like the Medicines for Malaria Venture, in which a compound can progress through all the little steps until it can get to clinical release. And of course, we can't skip those steps. It has to progress through that. And that can take typically 10 to 15 years to do. Now, whether this compound is going to take that long, most likely it may even take longer because it's new, it's innovative, and we have to still develop some of the mechanisms that's going to allow it to progress through those steps.
Thank you, Lyn-Marie. Innovative indeed, a breakthrough for sure. The University of Pretoria and everybody is very proud of you and the team for doing this amazing work, and we're looking forward to be collaborating and working close with you towards the end point, and that is elimination. So in summary, ladies and gentlemen, these new compounds therefore can potentially become another tool in the toolbox of interventions that can be used towards malaria control and the eventual elimination of malaria. Continuous research like this discovery is important for us to remain ahead of the disease. Malaria is both preventable and treatable, and it's best to avoid being bitten by mosquitoes when in malaria endemic areas. If you experience malaria-related symptoms, go see a doctor or healthcare provider for early diagnosis and rapid treatment. Bear in mind that COVID-19 and malaria have similar symptoms. Both diseases start with a mild fever, which can rapidly become more severe. I would like to thank Professor Lyn-Marie Birkholtz and the audience for watching. For more information, please visit our webpage www.malaria.up.ac.za. From Future Africa at the University of Pretoria, goodbye. Please take care and stay safe.